Hello, everyone. My name is Andrew Spiegel, and I'm honored to be the board chair of the World Patients Alliance. For those that don't know us, it is my honor to present to you a webinar today in which we hope to elevate the voice of the patient for patient safety. And this webinar is about patient engagement and patient safety around the world. We know that together we have the unique opportunity to improve the lives of patients around the globe. And today we're going to talk about patient safety as a very important part of that improvement. Next slide, please. So again, I'm the board chair of the World Patients Alliance. Most of my time has been spent in the cancer space. But for 4 years now, I've been chair of the World Patients Alliance and really proud of where the organization has come. Next slide.
I can see the slides.
And so I'm welcoming everybody. And we're going to turn things over to Helen Haskell, who's going to run today's webinar. I just want to, before that, mention that we are now by far the world's largest patient organization working across all diseases with more than 450 patient organizations from 121 countries. So truly representing the patient voice across the world. Next slide. And with that, I will introduce now Helen Haskell. Since the tragic death of her son in 2000, Helen has worked to bring the patient voice to healthcare safety and quality. Most people on the webinar will know Helen. She's the president of the American nonprofit patient organization Mothers Against Medical Errors and Consumers Advancing Patient Safety, and is an Institute for Healthcare Improvement Senior Fellow. She is the chair of our Patient Safety and Quality Council, and she is the former co-chair of the WHO's Patients for Patient Safety Advisory Group, and a recently retired board member of the Accreditation Council for Graduate Medical Education and the Institute for Healthcare Improvement. She's a member of the board of the International Society for Rapid Response Systems, the Patient Safety Action Network, on the steering committee of the Consumers Union for Evidence-Based Medicine. You can see that she serves on lots of other boards, and I could spend the whole hour talking about Helen, but instead of doing that, I'll just turn things over to Helen and she will run things from here. So Helen, thank you.
Nick, thank you so much, Andrew. Can we have the next?
I think you're muted.
Oh dear.
Then I take my screen off.
I am not muted. Can you hear me?
Helen, can anybody else hear Helen?
Yes, we can hear.
Helen, you're muted.
No, I can hear her.
Okay. I hope everyone
Now it says you're unmuted, but I don't hear you. I don't know if others do.
Okay. I will, let me see, where are we? Can you back up a little bit? Previous slide, please.
The slides, this is a problem.
Okay. So let's see. Next slide, please. All right. So this is our agenda for today. You just saw flash by the pictures of our outstanding lineup of speakers. We have Neelam Dingra from the WHO, Jolanta Bolinska from the Patient Safety Foundation in Poland, Nagwa Metwali, who is a patient safety champion in Egypt, and we have via recording Stephanie Newell and Carol Bennett, who will tell us about consumer activism in Australia. Next slide, please. Oh, sorry. Before we get started, our first up will be Neelam Dingra. I just wanted to say a few words about the concept of patient engagement. This patient engagement is the 2023 World Patient Safety Day theme, for those of you who don't know it. This is something that's been a long time coming. People tend to think of different things when they hear the term patient engagement. So I've heard from some doctors in the U.S., where I'm from, where patient engagement has been sort of institutionalized, and they often think it refers to areas like patient advisory council and doesn't really have much to do with them or their patients. I think most people probably tend to think that's primarily what it's about, communication and patient-centeredness in healthcare encounters. But the World Health Organization and others who work closely on patient engagement take a much broader view. And that's what we're going to look at today. They see patient engagement as operating on a number of levels, all of which need to be integrated to really be effective. So we have three main levels, what the sociologists call micro, meso, and macro, small, medium, and large, going from the individual encounter, the patient and provider level, to the institutional level, the patient and practices and policies of hospitals and health systems, to the governmental level, which are policies and laws, funding set at national, state, and community levels. And we add a fourth one, the global level, which is policies and guidelines from global and regional organizations like the World Health Organization. So we're going to be talking about all these levels in the webinar, and most importantly, the value that patients bring to improving patient safety in healthcare. So we will begin with Dr. Neelam Dhingra, who's going to give us a global overview of patient engagement and tell us about some of the really exciting things that are going on now. Dr. Dhingra is the head of the patient safety flagship at WHO, and she's been the driving force behind the Global Patient Safety Action Plan, which she'll tell us a little more about, World Patient Safety Day, and the emphasis on patient engagement and patient safety that we're here to talk about today. So, next slide, please. Neelam, welcome, and we are honored to have you. Thank you so much.
Thank you, Helen, for giving me this opportunity, and thank you to Andrew and Hussein as well. My congratulations to the World Patients Alliance for being the strong force of patient voice globally. And as we are meeting on the occasion of the World Patient Safety Day, I want to congratulate all those who are attending, and also wishing them a very happy World Patient Safety Day, which we observed on Sunday. However, the activities continue, and it is definitely our global effort to maximize the impact of the day and the focus it has brought this year on engaging patients for patient safety. As you know, that World Patient Safety Day provides a unique platform every year globally to highlight the issues of concern where urgent action is required. And we have a new theme each year. Since the day was established based on a WHO resolution in 2019, it has gone from strength to strength. Patient engagement and empowerment has been actually in all the years' themes, but not as explicit as it has been this time. So this time, the entire focus in on how do we engage patients and families to improve patient safety. We all recognize the central role which patients and families and caregivers play, very pivotal role in advancing healthcare as well as ensuring patient safety, and that led to selection of the theme of this year. For achieving safe care, we require patients and families who are informed, involved, and treated as full partners, so that we can build onto their experience and their insights to improve health services and the safety of healthcare. There is ample evidence globally that when patients are treated as partners in their own care, there are significant gains which are made in safety, of course, but even overall patient satisfaction, better health outcomes. So it's really the direction for us to go. And if we have not so far gone in that direction, we have not really actually worked on a patient-centered care. We've been actually designing care earlier for patients, but now we need to bring the paradigm shift that the care should be designed with patients, so that not only they improve their own safety when they access health services, but they actually contribute to actual improvements and safety of the health services itself. First, do no harm, we all recognize, is the most important foundational principle of any healthcare system. That means that no one should be harmed in healthcare. And there is a moral and ethical imperative as well for patient safety. However, despite the principle of first do no harm, millions of patients are harmed and lose life in healthcare settings, all type of healthcare settings due to unsafe care. whether they are hospitals or primary care services or emergency services, rehabilitation, palliative care, long-term care, homes, pharmacies. So outpatient settings, in all settings, there is ample evidence of harm taking place because of unsafe care. Safe healthcare is a fundamental right of all patients everywhere, every time. And no one should be harmed in healthcare. But most of the, and we realize that most of the harm which is happening actually is avoidable. So it's really unnecessary, and safety should be first. And safety is non-negotiable. It's not that we should have it or not. It's really an irony that we are speaking of patient safety, because patients, when they access healthcare, they are not expecting that they are going to be harmed. Thousands and thousands and millions of patients and families access healthcare systems across the world every day, but they are not expecting that they are going to be harmed. So most of this harm actually which is happening is avoidable. And how do we avoid it? Through simple strategies and interventions. And then even then we are not able to implement those strategies. So globally there's been a real momentum to take this forward. Patients and family engagement, as we understand, is a key strategy we should incorporate and we should integrate when we are developing safer health systems, particularly when we are developing resilient health systems in the aftermath of the pandemic. So safety and resilience are really the two mantras when we go ahead in developing safer health systems, and patient and family engagement is at the heart of it, to have the patient-centered approach to health services. Patient safety truly depends on the full involvement of patients and families. Why? Because they are the users of healthcare system, and they are the most familiar with the entire journey of patients. Their experiences and their insights are really invaluable, because they are the real users, and they also can contribute to the safety of health systems, as I mentioned earlier. So the perspectives and experiences of patients and families, how care should be delivered, is very invaluable. And it really requires, as I said, the shift from care designed for patients to care designed with patients. There is evidence that meaningful patient engagement can actually reduce the burden of harm by up to 15% in healthcare, which can save millions of lives and billions of dollars each year. So the global momentum, which I mentioned, was created through the annual ministerial summits on patient safety, led to a landmark resolution in 2019, which also established the World Patient Safety Day and urged member states to prioritize patient safety and asked WHO to develop a global patient safety action plan. This action plan is a roadmap for next 10 years for our concerted action on patient safety broadly. And it has patient and family engagement as one of the key strategic objectives to achieve zero harm, or towards eliminating avoidable harm in healthcare. The Global Patient Safety Action Plan identifies that patient engagement and empowerment is perhaps the most powerful tool to improve patient safety. However, we also realize that patient and family engagement is also perhaps the weakest link in patient safety. Patients and families and the knowledge and the experience they bring is actually a hugely untapped resource for patient safety. So we have to involve patients at every level of healthcare, from having fully informed consent to shared decision-making at the point of care to policy making and planning. We must elevate the voice of patients, as is the slogan of the campaign this year, and we must listen and learn from their experience. Everybody has a role to play: policymakers, healthcare leaders, healthcare managers, healthcare workers, patient advocates, civil society organizations, and finally, and most importantly, patients and their families and caregivers. At WHO, we truly draw our inspiration to work in patient safety from people who have been harmed in healthcare due to weaknesses in the healthcare system, and which was totally avoidable. The value of patient-family engagement for ensuring safe care is really indisputable, and is the way for creating a stronger and resilient health system that respects, listens, and learns from patients and families. So with this platform today from the World Patient Alliance, I call on all those who are present here to initiate their efforts in a meaningful way to engage patients and families and demonstrate the change in safety over the coming years. Thank you so much indeed, Helen and all colleagues.
Thank you so much, Neelam. That was a wonderful overview and setting the stage for our next presentations, which are all going to be from members of the World Patient Alliance Patient Safety and Quality Council. We wanted to showcase their global involvement and their global achievements. So the next person up is Nagwa Metwali from Egypt. Oh, sorry, Jolanta Bolinska. Next slide, please. But before, who's going to talk to us about polypharmacy and medication management in senior citizens. Before she comes on, we want to have a short video that WPA has recently produced. You are here for the world premiere of our polypharmacy video, which comes from the Patient Safety and Quality Council at WPA, and is quite relevant to Jolanta's presentation. So, Harris, if you could just run the video, we will have that first.
Are you taking too many medications? How many medications do you take? Do you take more than 5? That is called polypharmacy. Polypharmacy means many medications, and taking too many medications can hurt you if you're not careful. That's especially true if you're a person over 65. Did you know? Medication side effects are responsible for about half the harm from medical error in the world. Most serious harm from medications occurs in people who are over 65 years old and taking 5 or more medications. Over-medication of senior citizens is a problem in every part of the world. Older people often take multiple medications because, as we age, we develop health conditions like high blood pressure, diabetes, or heart problems. But sometimes people take medications they don't really need, or that should not be taken together, or they take them for longer than needed, and some drug doses need to be reduced for older people. How can you find out if your medications are all safe for you to take? Review your medication list with your healthcare provider. Include everything you take. Even non-prescription medicines, like vitamins, can sometimes be unsafe when combined with others. Learn about your medications. What are their names? What are they all for? What are the signs of side effects or overdose? Ask how well the medication works and what would happen if you didn't take it. Sometimes the side effects are worse than the condition for which you're taking it. To learn more, visit the World Health Organization Medication Safety Challenge or visit our website at www.worldpatientsalliance.org. World Patients Alliance, the global voice of patients.
Thank you, Harris. And that video is available on the World Patients Alliance YouTube channel, along with our other videos. We have another one we'll show you a little later, and we also created one for World Patient Safety Day last year. So our next speaker up is Jolanta Bolinska from Poland. Yes. Jolanska wears many hats. She's a founding board member of the World Patients Alliance. She is one of the original WHO Patients for Patient Safety champions and is head of the Polish Patient Safety Foundation, among many other accomplishments. You can see her bio here and on the website. And she is going to speak to us about managing medications in senior citizens. Next slide, please.
Good afternoon to everybody. From last week, we celebrate Patient Safety Day. I and Hussein, we were in Geneva, and on Sunday, it was also a webinar about Patient Safety Day. And I am happy that today I can share with you one very small part of patient engagement, patient empowerment, how I am doing it in my foundation and in hospital in which I work with polypharmacy, with people who use sometimes to 30 tablets. It's not, you not hear me? Yeah. So if we think who is a senior, it is a person that something disturbed me to talk. I don't know what it is. A senior is a person who has reached a certain age when key changes in the body occur. So this is reduced cell regeneration and wear of organs. In some countries, 60 is age of 60 is considered being a senior. In others, it is 65 to 70. According to WHO, 60 to 75 is old age, 75, 90 is very old age, and 90 plus is longevity. Next slide, please. So as I mentioned, I gave you the data about my country. In Poland, there are living 37 millions of citizens. And as you see from the last year, number of people over 60 years old is almost 10 million. The average life expectancy is for men 74 and for women much longer, 83. The main problems have the Polish senior people are similar in the Eastern European countries, but I think also in every country of the world similar problems occur. So this is difficult economic situation, housing problems. There is complicated access to healthcare. There are long waiting lists for specialist doctor, and it is not only in my country, but it is everywhere. It is insufficient communication with medical staff and comorbidities such as hypertension, degenerative disease of the musculoskeletal system, and memory disorders. And sometimes also type 2 diabetes and cancer. Next slide, please. How behave the senior people? Sometimes they have regression, so they will go through the everyday life. Sometimes they escape, and sometimes they isolate from the environment, and sometimes they very good integrate and are very adaptive in the social life. In my hospital, there is a special department only for senior people who need help because they take much too many medication, more than not even 5, 20, 30 tablets, pills a day. Next slide. And that's why, so for people who are very active, we organize many various activities, and there is yoga, Nordic walking, Pilates, Tai Chi. They are also a special center. They receive more information about health literacy. They receive information about how to change habits about food, how to change habits about physical activity. So this is for these people who very nice adaptate for in social life. Next slide. But we have also people who, like this man, take too many medicine. They start sometimes because they can't sleep in the night, so they are sleeping pills. Then they go to different specialists. They go to cardiologists, and cardiologists prescribes 5, 6 medicine. Another 5 medicine they receive from neurologists. Other 3 tablets from another specialist, and in fact they take 15, 20 medicine, and it is not under any control. So we give the advice to people who take more than 5 medicine, but not 30, to contact a family doctor, because the family doctor should always receive the information from different consultation which medicine is prescribed. And during the consultation by family doctor, he can check on the computer. Minister of Health give a special picture which medicine goes well for the patient and which medicine goes in interaction, which is not good for the patient. So I knew some patients who take more than 30 tablets a day. This cannot be reduced by the family doctor. This we can only do in a hospital. So during the hospitalization, the whole process of medication is reduced and changed. Please, next slide. Next slide, please. So that's why this medical reconciliation is a main goal for work for our doctors who are at the Patient Safety Foundation, and they make a detailed interview with patients, and then they change through the family doctor, they change the medicine. Next slide, please. In this process, they are involved and medical staff and every patient and also family. What you see on the photo, it was a special campaign for senior people. They received a special box. In this box, they put a paper, and on this paper, they were written all medicine which are prescribed. And it is very important because this box was hidden in the fridge. And if sometimes something happens to the patients, from this fridge can take emergency team this prescribed medicine, and they know how to help very quickly to the patients. So this is important to have such box or such paper. Every senior person should have it anywhere at home, but in Poland we keep it in the fridge. If the emergency comes, just go to the fridge, open, and they know, oh, this person take this medicine. We also do a lot of training for senior people because we know that incorrect information about the medication it could lead to an appropriate treatment and failure to detect a problem related to the medication which the patient is taking. And 27% of hospital medication errors involve incorrect data which is obtained when patients were admitted to the hospital. The most serious error is the omission of regularly taken by the patient. Sometimes the patient is taken to the hospital and just the interview is too short, or patient forget to tell to the nurse or to the doctor which medicine he takes regularly. Or you know what is the error sometimes? Patient doesn't give to the medical staff their medicine, and he took medicine by themselves and another medicine take from the medical staff. And it looks like a stupid idea, but it happens really many times in the hospital. That's why it is very important to have this very good interview when patient is admitted to the hospital. Next slide, please. Now, Canadian did last observation, and this study showed that 23% of patients discharged from the Department of Internal Medicine has side effects, and 72% of them were related to drug therapy. That's why we need to involve patients in the medication list. A patient should have a lot of educational materials, poster, but you know what is the most important? The good communication between nurse and patients, that they know all about the treatment, that they know how important is compliance, how important is that patient understand why he should or she should take medicine properly, regularly, every day. Because sometimes patient is thinking, oh, I have hypertension, but today I forget about my medicine, or for next 3 days I am very busy, so I don't take this medicine. It is wrong. It's important, this compliance, that patient understand why it is so important to take proper the medicine. Next slide. These are general questions about the taking medicine. So we ask patient if he has a list of medication, how he take this medication. Sometimes patient cannot very good swallow the tablets, so he can ask or tell it to the doctor and change the medicine. So these are important questions about the whole process of interview. And if patients should also know that vitamins, minerals, all what is in media, in television, there is all count to these tablets which we take. So this is important that we all know how many tablets we know, and especially for senior people. One slide more. Next slide. As I mentioned, the communication is very crucial, and during the foundation meeting, we do an interview with different consultants. We teach patients how to be involved in the process, what to ask, how to take properly the medicine, and also these lessons give patients, empower patients to be involved in the whole process. Next slide. Thank you for the attention, and there are some senior groups which come to our meetings for my foundation and also for the hospital. Thank you.
Thank you, Jolanta, for that very specific application of patient engagement. We have resources on medication safety on the website, on the page for this World Patient Safety Day, and also last year. And this is a great example of applying them. So our next speaker is going to be Nagwa Metwali from Egypt. Before she comes on, we're going to have another video, our patient engagement video in honor of World Patient Safety Day this year, entitled How to Talk to Your Provider. This is a little video with tips for patients on communicating well and making the most of their appointment. Harris, could you run the video?
Healthcare provider. How do you talk to your healthcare provider? When you visit your doctor or nurse, how do you talk to them? Did you know? Healthcare providers base most of their medical decisions on what you say to them. But most healthcare providers are rushed because they have so many patients. It's important to make the most of the time you have by being brief and to the point. Here are a few tips. Before you go to an appointment, think about what you want to say and how you'll say it. What are you most worried about? What are you hoping to get out of the appointment? Organize your thoughts. Think about how to describe your problem. Has it changed over time? What makes it better or worse? Write down your questions or record a voice message to help you remember. Do your homework. If you can, look up your symptoms online or in a health guide. Having some knowledge will help you have a more informed conversation. Take a friend or family member with you, especially if you have a language barrier. Ask the provider to explain their reasoning for your diagnosis and treatment. Repeat out loud what you understood them to say. Before you leave, be sure that you and your provider agree on the next steps. Ask what to do if your condition changes. Always be respectful and courteous and expect the same in return. Healthcare can only work well if you and your provider are working together. To learn more, visit the World Health Organization Patient Safety Flagship or visit our website at www.worldpatientsalliance.org. World Patients Alliance, the global voice of patients.
Thank you, Harris. And now we will hear from Nagwa Metwali, who is our longtime representative of patient safety in Egypt. She's worked in many capacities in Egypt for many years. She's a former member of the Supreme Council of the Red Crescent. She works closely with Al Ain Shams Hospital in Egypt and has been responsible there for much patient safety improvement over the years. Nagwa and I are going to have a short discussion, an interview format about some of the current initiatives in Egypt, which I think are really quite eventful in terms of patient engagement and patient safety. So next slide, please, Harris. Nagwa, welcome.
Hi, Helen. How are you?
So I'm going to start out by
Thank
asking
you.
you to tell us a little bit about what is presently going on with patient safety in Egypt and what part you are playing in it.
Well, there is lots going on actually since I came back from Geneva. Every day there is an activity in one of the hospitals, and I'm really surprised by the enthusiastic feeling among the caregiver in hospitals after we talk and after they did very beautiful things to express their interest in the engagement of patient. And every day there was something to show. There was yesterday a meeting, a scientific meeting, which I give also a talk about, and everyone was talking about the engagement of patient. And actually, one of the things which is really struck me is the barriers. Everyone was talking about the barriers of for the engagement of patient, which is the more and more we go deep in this subject, the more we find it very difficult because of the level, the low level of the health literacy which we have here in Egypt sometimes, especially in the hospitals of the governmental hospital and all this, and then the ineffective education of the student and the caregiver about the importance of engaging the patient and engaging and to be something mutual between the caregiver and the patient. There is also patient unwilling and for cultural reasons, maybe the fear, maybe no education, maybe they don't know about it, there is no knowledge about what we are talking about. So this is one of the barriers as well. There is also some barriers was related to the staff, which is negative attitude towards engaging patient. And this is happened to me today. When I was in the conference of the psychiatrists, and then I was talking about that, and one of the professors, the old professor, she was attacking me, a little bit, you feel like, who are you to talk about anything about any care or health care? She did not say it like this, but I felt it from her words. She said, we are doing this and we are doing that and we are doing this. And it was something which is completely different of what I'm talking about. So we go back again to the arrogance of the professor. This is one of the big barriers. Ineffective communication between all in health system. One of the barriers also for the engagement of the patient is the high workload. They don't have time, and we are trying to find a way for those who are in the hospital just to give time to the patient more and more. So you can see that it's not an easy something, but it's we are on the way. I thought this year especially, it was a success for me that I reached the Minister of Health, and now the Minister of Health is leading all the activities about patient safety in Egypt, which for the first time that the Minister of Health engaging on something called patient safety and patient engagement. We have a conference on the 25th, joint conference between the Ministry of Health and accreditation and this unit of accreditation, the national unit of accreditation, and of the WHO, the office of the WHO. And I think that the Minister of Health will say something which is very encouraging, that we start to spread the culture of the patient safety engagement in Egypt, and about the patient safety engagement as a culture, and how can we try not to have a very safe treatment without any errors anymore, and we try to talk about it more and more. I hope that I can make the Minister of Health involved in all this. And what I'm trying to do this year is to convince the Ministry of Health, which I hope I can, to have a group of NGOs in every hospital. So I'm trying to have some NGOs group, even minimum 2 or 3 in every hospitals, all over the nation. I will try that, because this is my maximum goal, which I hope that I can reach this goal this year. This is some of the activities, but there is more and more and more. But I leave the time because short of time, and I leave my colleagues to have their talks. I don't want to take too much time. If you have any question, Helen, I'm ready.
Thank you, Nagwa. No, you really have covered it very thoroughly, I think, in this first question. One of the things I want to say, Nagwa always has talked about, one of the things that Nagwa has said that really has made an impression on me was how everything is interconnected. You can't have patient engagement without provider engagement, without solving the problems at a higher level. I think that's really very profound. Nothing stands on its own. So thank you so much, Nagwa. We will have more in the discussion.
Thank you, Helen. Thank you, everyone.
Yes.
And for everyone.
Next slide, please. So now we're going to have via recording Carol Bennett and Stephanie Newell. Next slide, please. Who are 2 Australian consumer advocates with a long history in healthcare and patient engagement and patient safety. They're going to talk about the very interesting approach that Australia takes to patient engagement and healthcare issues. So next slide, please.
Well, thanks for that introduction. I'm Carol Bennett.
And I'm Steph Newell.
And we are here today to talk to you about patient engagement, and particularly the Australian example. Both Steph and I have been involved in patient engagement and lived experience of patient safety for a number of decades. We've sought to bring, that patient or lived experience to the fore. And Australia has, I think, performed particularly well in that regard. So we want to talk to you a little bit about why that is today. So I believe that in Australia we really look to the values of, the fact that there is a belief that healthcare should be informed by patients and consumer perspectives. And their experiences and needs. And that means really listening to consumers and validating their experiences of healthcare, but also basing policy on what will produce the best outcomes for the patient rather than continuing to just focus on the needs of the health system. In terms of patients and the healthcare system and the sorts of change that we want in Australia, patient groups are often working quite closely with health provider groups to achieve real reform. And we see that played out in different ways, but it has been my experience that when you're working with provider groups and you're pushing in the same direction, it tends to wield a lot more influence with media, with government, with public support. And just to give you an example of how that works in Australia, often we have consumer representatives sitting on various stakeholder advisory groups, and that can include pharmaceutical companies or industry, if you like. It can include, or does include, doctors groups, patients groups, government, of course, and a range of healthcare providers that sit on these advisory councils. I sit on one in the medicine safety space, and it works really well when consumers are part of that discussion and they're considered as equal partners in that discussion. So I often get asked, why does the Australian government provide dedicated funding for patient participation in healthcare decision making? And look, we've been doing this for quite a long time now, right back to the 1980s, when the Consumers Health Forum, the national peak body representing patients and their involvement in healthcare, was established. And it was actually written into the legislation that patients must be involved as a stakeholder, that had to be consulted. So that was quite significant. And there are other examples, and Steph will talk a bit about the Australian Commission on Quality and Safety in Healthcare, which has a very specific focus on patient safety and involvement. So these things are very significant structures in terms of the level of involvement that consumers have in decisions about healthcare.
Thanks, Carol. I think, Carol's summary of the Australian landscape really puts a picture in that it has been consumers driving for many, many decades, and also that political will that we've seen in some governments that have initiated and put a real stable initiatives in place that, regardless of who's in government, those do continue. So I'd just like to turn the focus a little bit around the focus on patient safety in particular, knowing that pretty much, a lot of what we all do is related to safety. But in particular, in 2009, we held the Perth World Health Organization Perth Patients for Patient Safety workshop, which was a 3-day workshop. Now, this was a collaborative with a lot of partners across Australia, and in particular Western Australia. So there was, it wasn't, we didn't get funded just by one body. It was certainly us being imaginative around funding and the partners that we had. So we held the workshop, and this is where we brought policymakers, consumers who'd experienced an adverse event, and health professionals together in a appreciative inquiry focused process where we listened to one another without judgment, and to really formulate what we wanted to see in Australia and work together. And the outcome of that was the Perth Declaration for Patient Safety. And I've just popped up there some documents, the declaration itself, the Hansard from the WA, the Western Australian Parliament, that talks about the workshop, and also the Medical Journal of Australia, where we wrote an editorial in regard to the workshop. Sometimes it's just the timing is right, and that the environment is really ripe for people to come together to push for that next step. And so this is what the Perth Declaration did, because it was that time that we had a reasonably new formed the Australian Commission on Safety and Quality in Healthcare, and they were really focusing on patient-centred care, what that meant. They were engaging with consumers like myself in discussions around that, and other experts. And so their document on patient-centred care included the Perth Declaration of Patient Safety, and certainly we had a member from the Commission at the workshop, so that really helped them really understand some of the issues and concepts in the development of their work. And so subsequent to that, in 2013, a lot of work was done by the Commission around developing and implementing National Safety and Quality Health Service standards for Australia to get a national approach. Certainly there's a partnering with consumers standard, and that has been developed with consumers like myself, so that consumers are actually embedded in system governance, in service delivery and planning, not just in their own care. So we've got a real suite of approaches here in Australia that have really accelerated consumer engagement, and certainly in consumer engagement in safety and quality.
Well,
Thank
thanks for
you.
that introduction. I'm Carol Bennett.
And I'm Steph Newell.
Okay, I'm not sure where that came from. Well, we have about 4 minutes left in our hour, and we want to have a discussion with our speakers. If anyone can stay on longer, we can have a longer discussion. But I will start with some questions from our audience, which are actually similar to questions that I was thinking of asking everyone, which are the first is, what are your tips to raise the awareness of patient engagement in the day-to-day business of non-governmental organizations? And I would take that a little further and say, what is your advice for patient advocates who really want to make a difference in patient safety? Patient support groups are doing a lot of work to engage patients in self-management, but they're not really integrated often within the healthcare facilities as a system. So how can we integrate all these efforts together? So I will actually start with Nagwa. Do you have any answers to that question?
I think it's a difficult question, Helen, and it's new. It's new, this question, and the answer is not yet complete for this question, because the word even, they don't know much about it. Only 2 branches in the medicine, which they are in contact with the patient and in their engagement, is the geriatric, because they need the parent and the family, and the other one is psychiatry, because they listen and they listen to the patient. Otherwise, they will not work. But otherwise, all the other thing is not easy. You have also to have the commitment of the leaders. They should be committed to all this idea. Otherwise, there is no breakthrough to what we want. This is what I discovered more and more. But it doesn't mean that we give up. We keep on trying and trying and trying until we reach our goals about the engaging of people, engaging of families, and engaging of the patient in the healthcare system as a whole. Because we know all that this is for the benefit of both. So we hope that we stick together, and we little bit the voice more high and high of the patient and the engagement of the patient in this. But I tell you, I don't know, I had this feeling today when I left the conference that it's not easy. But we'll see.
Yeah. Well, Neelam, I would love to have your high-level perspective on this. How do what advice would you give to patient advocates who want to make a difference? How do you affect leadership? And how do NGOs become more involved in healthcare systems? 3 questions in one, I guess.
Right. So thank you, Helen, and wonderful presentations and amazing videos. My congratulations to WPA colleagues. So I think, how do we influence patient engagement at global level? And I would emphasize the 5 strategies which are described in the Global Patient Safety Action Plan, because there's a very well structured approach to so that we don't miss anything important, and how do we really engage and empower patients and families so that they can help the healthcare system in this journey for safer healthcare. So the first is co-development, that we have to identify opportunities for co-development of policies, plans, strategies, programs, guidelines, any opportunity wherever there is an open sort of consultative process to contribute to that. A co-development is a really, very vital, tangible approach to engaging patients. Now, how do we actually initiate these mechanisms? The Patients for Patient Safety networks, I must say, have been extremely helpful in bringing together those families and patients who have been harmed in healthcare so that we could collectively have a voice, and the experience of patients and families and the insights from them feeding into the health system. So patients and family engagement, Patients for Patient Safety network, which already being created in many countries, they have to have this interaction with at the 3 levels, as you mentioned, Helen. So micro, meso, and macro level. And particularly tangible, I think, is let's say the meso level, which is at the organization and the provision of care. So WHO already through the Global Patient Safety Action Plan has asked countries and hospitals to have patient representatives on the board of, executive boards or the governing boards of hospitals. So there is a formal structure where patient representatives can contribute. So first is co-development. Second is learning from the experience of patients and families so that we can develop innovative solutions. Third is actually capacity building of patients advocates. And the WHO and several other organizations, these webinars itself are very, very helpful in building the capacity of patients and families who want to become patient voice, the patient safety advocates, to be familiar with the patient safety world. What's happening? Which are the tools available? How to, how to empower patients to ask questions. Several patient engagement tools are available as well, which provide the insight into what, even these videos are very powerful in how do patients and families who access the health system ask questions. So, and then the entire issue of actually open disclosure as well. So that's the 4th strategy, that a system of transparency and openness where the healthcare leaders and health workers disclose to patients and families of what went wrong in their healthcare so that they can contribute, they can understand what went wrong through an open disclosure policy and procedures. And finally, education and training of patients and families. So through materials, through videos, through different channels. So these are the 5 strategies. And I think implementation of those at different levels, macro, meso, and micro level, will be really instrumental. I think that probably answers all the 3 questions. It touches upon all the 3 questions because the actions in the action plan are for stakeholders under these strategies only. So they are very concrete actions identified. For example, establishing these networks and platforms and events, which I mentioned is a very important opportunity for learning from the experience. And patient reporting, I think, is another one. We have to have, patients should be demanding safer care, and if something goes wrong, they should report to the health facilities and health system. And that's an opportunity to learn. So I'll stop here. I'll come back later. Thank you.
Thank you, Neelam. That's very helpful and very comprehensive. I have a little follow-up for you from Salah Hossan, asking if there are international laws or standards for mentoring and organizing the relationships and cooperation in patient safety. Aside from what you've just told us, are there laws, are there formal mechanisms? I think that's what she's asking.
Yeah, so I would say not really international laws from that point of view, except, of course, the treaties and the convention which WHO has with countries. But particularly, the last week, what we worked together was the Patient Safety Rights Charter. I think that is a first step in that direction. So those of you who were not able to attend the WHO Global Conference last week on engaging patients for patient safety, we actually co-developed a list of patient safety rights, which should be embedded in any legislation a country is developing on patient safety. And this is a first step to develop the charter, the rights charter, and we'll be opening it for public consultation so that we have more inclusive input from everyone who's involved in this field. And then the patient safety rights charter will then give the direction to national authorities for laws at national level. Thank you.
Wonderful. Thank you. So, Yolanta, I would like to ask you, what is your advice for patient advocates who are trying to make a difference in patient safety? What would you suggest that they do first?
So I think the patient safety advocates, they play a really crucial role in improving healthcare outcomes and ensuring the well-being of patients. There are some pieces which I can advise to do for better patient safety. There is educate yourself, but be careful in using a best educational platform. Build a network with other champions, with other organizations. Another lesson is to empower patients, promote the communication. And one thing more, we should listen to patients, what they talk to us. So this is, I think, very crucial. It is also very much intended to have communication and good transparency and promote all patient safety initiatives. It is also important that we stay informed about regulations in the country about patient safety and that we raise awareness about patient safety issues. So we should really be resilient and persistence in effort to make a difference in patient safety. Thank you. It was one question also on the chat about this reconciliation medication. So I was inspired by WHO materials which are on WHO site, and we translated somehow in Polish, and then we try to implement this according to this WHO page. Thank you.
And we will have links to all those materials, the WHO materials, and some other really good materials from countries like Scotland and Canada on our on the page for this webinar. So that's great. If people can stay on longer, I have one more question, which I would like to ask everyone, which is, what is your hope for patient engagement and patient safety? What is your vision for the future? And Yolanta, I'll just start again with you.
For the future, I would love to have a really good health literacy for all patients, and that we fill all communication gaps, and that we really have patient satisfaction. So for this, we need really to talk to patients, to be with them, and I think it could help for the future. The most important thing for me is the communication. If we have a proper communication in healthcare settings, among the participants or any meetings between the medical staff and patient, we can achieve a success. So communication and good support from family, from other people. If they are senior people, they should have a support from somebody to listen what is the doctor advice, what is the consultation, because these people forget very easily what the doctor says. So they need a support. If we have in our circle any senior people, please help them to better understand and to be engaged and empowered in their treatment. Thank you.
Okay. Nagwa, can you briefly add to that? And then we will wrap up with Dr. Neelam.
Actually, I don't know, Helen.
What do you hope to accomplish in Egypt?
Yes, more knowledge about the education of patient, engaging the media This is what I'm really interested in, which I'm trying to do, because the power of media in our country is very, very strong. So if we reach the media and I talk about what we are talking about, it will be a good, very good success. The commitment again of the leader. Otherwise, you won't be able to do anything. You have to convince the leaders in all different health system about the importance of engaging the patient. This is what, I think this is the future. And the other thing is taking care of the student of the medical school and give them the knowledge and things about the engagement of patient, because they don't know. They just study how to treat the patient, but how to engage the patient, this is something which they don't hear about it. So this is very important, because those are the future. If we reach the three things will be very easy to engage the patient. And we are trying to do that.
Thank you, Neelam. Thank you, Nagwa. That's very insightful. And so, Dr. Neelam, please give us your perspective from the WHO.
Thank you, Helen. I think it's a very important perspective on, what is the hope for future for patient engagement. And I must say that the World Patient Safety Day this year and the activities around World Patient Safety Day, I'm very, very sure will have a deep impact on moving needle on this. We want every patient and family who accesses health system to be fully engaged and empowered, to know about their medical procedure, to know about their treatment, to know about their rights and also responsibilities and demand for safer care. So until as we have, demand coming from the ground, we won't be able to influence those who have to provide safer care. It's not about they and us. It's actually is working together. So truly a patient-centered approach and health systems can only be established when patients and families are really at the center of healthcare system. So my hope is with this World Patient Safety Day, there will be a literacy of patients and families about their treatment, about health literacy in general. And when they are more informed, they are more knowledgeable, they are empowered, and then they are engaged to ask questions. So, and the organizations around the world are, doing tremendous work. I truly believe that stars have never been more aligned for patient safety as in the last couple of years. And the momentum which has been generated is unprecedented. We should not leave it. We should not leave the job unfinished. So we should take it forward and,
Please mute your microphone.
And the other thing is about the vision. The vision is actually in terms of the patient safety vision, which has already been outlined in the Global Action Plan, is a world in which no one is harmed in healthcare and everyone receives safe and respectful care every time, everywhere. And I truly believe that this vision cannot be realized without actually patients and families being at the center of healthcare. So the vision is that every time the patients and families and people access the health system, and when they come out of the health system, they are fully informed and engaged in their own care, as well as they contribute to the bigger good of the entire health system. Thank you.
Wonderful. Thank you, Neelam. Hussein, can you wrap us up? I think next slide, please. Yes. Hussein, you're on mute.
Well, I could wrap us up. Helen, thank you so much for leading today's webinar. Dr. Dhingra, Nagwa, and Yolanta, and everybody, thank you so much for getting this really important webinar together and for the great presentations today. I leave feeling very optimistic about what Dr. Dhingra has just said, that things are looking better than ever. And we're going to continue to lead World Patient Safety Day with all of our programs and events. As everyone probably remembers, we've held over 1,200 World Patient Safety Day events in the past, and we'll continue to champion that cause because it's so important. And last thing I'll say is that if you haven't already registered, for our regional meeting in Dubai. It is November 4th and 5th. It is a hybrid meeting, so if you can make it to Dubai, please do register. And if not, there is a Zoom link that's going around that you can register for the hybrid event and participate via Zoom, so you don't have to go to Dubai. Although, why wouldn't you want to go to Dubai, right? So please go to worldpatientsalliance.org and do register for our Asia Pacific regional meeting, so we can have experts in that region cover the healthcare issues that they're facing. We have a workshop on sustainability coming up on November 16th. You can register for that at worldpatientsalliance.org as well. And in fact, I will be going to the International Hospital Federation's annual Congress in a few weeks. And we'll be presenting some of our perspective on sustainability and how hospital systems can be more planet friendly. So please do register for that as well. And then in December, we have patient-centered care and patient engagement, another workshop. So you can register for all of these at worldpatientsalliance.org. Next slide. And please follow us on social media. You can see all of our handles here for social media. We're very active, and we not only promote what we're doing, but we promote what our members are doing. More than 450 members. So when you have important events that are coming up, congresses, conferences, things like that, please tell us and we will promote it. So thank you everyone for attending. Thank you to the presenters. Have a great rest of your day, and we'll see you at the next event. Bye-bye all.
Thank you, everybody.
Bye.